It's the Embodied Performance Podcast, episode 20. I'm Nick Markey, Beach Barbell, physical therapy and performance and strength training in Wilmington, North Carolina. Gonna keep this one a little shorter today for Friday. Think I'm gonna touch on chronic pain for a third part. So the first part, a couple days ago, talked about some deeper layers, basically that, all pain doesn't originate in the tissue that you feel the pain in. So if you feel the pain in your ankle, the pain doesn't exist there. Signals have to travel up through several layers of nerves all the way up to the brain. And then depending on the context and the situation, the brain will decide if pain is necessary. I would assume more or less how threatening the pain is, and other contextual situations, like if you severely hurt your ankle, you injured it, you rolled it, whatever, and you're running from a bear, the context would probably make it that you wouldn't feel that pain until you survived the bear and made it to safety. And then, if needed, the body might make you, experience pain because now you can, pay attention to the ankle. Yesterday's podcast, so part 2, talked about some of my ideas towards trying to help somebody dealing with chronic pain, persistent pain, from my movement and physical therapy perspective. Basically recommending to start slow with movement. Don't focus so much on what imaging is saying, what you're seeing on those MRIs and whatnot. Like we talked about the back. A lot of those studies also show similar things in different areas. In terms of when they compare it to people that aren't feeling symptoms, and their images show similar things that the people that are feeling symptoms. So telling us that, maybe not everything is popping up in that picture that we can understand. And then with that, as a clinician, our job being not to scare people and more reassure them and help guide them to maybe a path that seems reasonable and helps them enjoy more of their life and reduce suffering, and not so much focus on pain per se. Although if there are, reasonably cost from time, effort, and money to help someone with reducing pain, certainly that could help reducing their suffering potentially as well. But not always chasing that, because a lot of people do go through treatments over and over and over. So what I kind of wanted to touch on that again, kind of expand the explanation a little bit. Basically the kind of the cycle, that I'll see with different people dealing with chronic persistent pain. There's sometimes like a boom and bust cycle. So maybe when symptoms are a little lower, the person will go and do a whole bunch of movement and activity and perhaps feel okay during it. But then maybe they'll be, in a lot of pain for, several days, weeks. So they kind of go up and down, go up and down. That has the potential to maybe make the system more sensitive. If it doesn't make the system more sensitive, then obviously there's just the cost of, being able to do a good day or enjoy a good day or whatever, and have to perhaps suffer for many, many more. So you're paying for one day with many more days as a cost. And that kind of goes back to talking about the going little by little, as in terms of trying to do things. So when you have a good day, you don't necessarily do a whole lot more than you would on average or what you're used to doing. You might just do a little bit more. And talked about yesterday, maybe purposely walking away while it's still easy, to kind of build up those victories, and then every day committing to do something, even if it's small, and then over time that'll add up, and perhaps you will be able to mitigate having some of those boom and bust cycles. Another thing that oftentimes, going back to the patients getting a lot of treatments, again, I touched on this yesterday, but basically you have a person has a problem and they go to somebody, a professional, clinician, whatever, to help them with that problem. The oftentimes clinicians will be very certain of what they think is going on, and then their solution, fixes that problem. And if it does, say that it completely eliminates the problem, awesome, right? That's a great thing. And that'll probably be a testimonial patient that'll pop up on their website or their advertising, right? But you don't get to hear about all the patients that their solution didn't do anything. And the fact is that just because a solution worked doesn't necessarily always mean that it worked because of the mechanism they think it does. Now, that may not matter to most people, but the reality is for us to understand more about the person and the body and how to help and how to come up with, better and better ways to try to help people and better understanding, we kind of have to know the mechanisms that are going on behind why things do or don't work. And frankly, we're just not there with a lot of stuff. A lot of it's very non-specific, which is why sometimes a lot of these solutions that are proposed from a lot of different clinicians and people are, maybe 50-50. But again, from a sales perspective, you're not going to hear the negative side. You're only going to hear the positive testimonials. Rarely is someone going to come at you with, 50 out of 100 people felt better with my solution and the other 50 felt the same or worse. So do you still want to pay me for this product or service? It's not probably good salesmanship, I guess, to focus on that or to bring up that negative. Although from a patient point of view, that's, suffering from something, persistent pain, from their point of view, they should be, I think, asking about those potential negatives. So what can happen though, so you say that, someone's going through that cycle, they try a treatment and maybe it works for a short period or maybe it doesn't work at all. The clinicians maybe don't always explicitly tell them that, look, sometimes these things just don't work for people and it's nothing against you. You're not broken. It's just this thing didn't work for you and it's okay. Well, maybe we'll find a different thing. And so patients kind of go through this cycle of hope. And then, when it's that hope doesn't work out, then they have potential increased, worry about themselves and their condition. Like, just because this they propose that this mechanism would work for this thing that they said I have, but it didn't work. Therefore, I must be even more damaged than I thought. And so you can kind of get in this downward spiral where you just keep thinking that, you're just more and more damaged and less and less hope, as opposed to maybe a counter solution saying, hey, look, there's a lot of unknowns of what we know about this problem, but let's look at all the different factors of things that you are dealing with and let's address that. So if someone's not maybe exercising, let's see if we can start a simple program. Maybe that's doing exercise in a pool, maybe that's doing a little bit in a gym, maybe it's just going walking in the park, trying to find something that makes sense for them and sustainable. Okay, well, how about your nutrition? Is there anything we can change there? Like that could perhaps help. Let's look through that. What about your sleep quality? Or there's things that we can do to help improve your sleep. What about your stress and just, how you're coping with life and work and family and all that? Is there things we can address there? How about the purpose, your purpose in life is, what do you find, what makes you happy? What helps you find meaning? Let's see if we can get you more, time and enjoyment in that. And then, of course, sometimes medications can play a part in this role. So it becomes a bigger, what they call multidisciplinary approach, where you are trying to approach all these different aspects of somebody and just trying to help in any little way you can in any of those directions, with the greater hope that all those things will add up to a more enjoyable and less suffering in their life. But always with the caveat that, there's generally going to be ups and downs, and looking at it from a long-term approach in terms of trying to help this person. Now, that's not my way of saying that them finding short-term things that make them feel comfortable, or reduce suffering, at least temporarily, aren't bad, and that's great if you find some. But you always have to recognize the cost of those things. Sometimes are those things increasing potential negative outcomes in the long term with a short term, maybe just positive feeling. And is there ways and if that's the case, is there other things that we can explore that might provide that temporary, relief of suffering or pain, and aren't necessarily making the long term worse. So, and next part, just very briefly, the reality is, we mentioned MRIs and all that stuff, is MRIs really just give us an idea of kind of overall structure. They don't, if say that the idea that nerves become sensitive, and in reality, nerves are basically just a big bundle, and within that are tiny cells called neurons. That's the actual functional units of the nervous system. If they are sensitive, how many of those thousands of little neurons in that tube of that nerve are, sensitive? And by sensitive, we mean that they activate easier than maybe more normal sensitivity. Because it can go the other way. You can have, nerves that aren't sensitive enough or don't sense at all. And then that's where you get things like, peripheral neuropathy, diabetic neuropathy, where you may not have feeling in those parts. And that could be a very bad situation as well. So we just don't have the technology to really assess that nerve sensitivity, really in any positive way. So like, all we can really base it on is the person's experience. And so whether, the pain is primarily driven from something in the tissues out in the periphery, or if it's more driven by the nerves that are going, into the spinal cord and in the brain, and different links that happen in the brain regarding like fear and depression, we just don't know. That's why it's maybe a good idea to be very cautious, or very, as a patient, a person suffering from this, be more, analytical, kind of step back, be more skeptical of what people are proposing that they'll help fix you. We'll just do this surgery, we'll fix this broken part, and then you'll be good as new. It certainly has the potential of doing that, but what is the downside if it doesn't work? Are you now going to be even more sensitive, less mobile, less active, less quality of life, more suffering? And my advice with anybody, getting recommendations for more serious stuff like that, like surgery and whatnot, would be get multiple opinions from different people, different surgeons from, different offices, and really, grill them in a way, every single question, how long is recovery, usually how many patients have had this success, like a year or two later, how many patients are happy they had the surgery, really grill them on all that. And if you don't get quality answers, or, you don't feel confident in what they're saying to you, or they brush you off, then that might tell you all you need to know. So yeah, so I think that'll be good. I'll wrap up the chronic pain here, and most likely in the future, I'll touch upon it again, just as my thoughts swirl around it. But I hope these three-parter on the chronic pain will at least maybe give you some ideas on kind of what's going on, and what you may be able to do about it. And then certainly there's a lot more information coming out about it. Check out bodyandmind.org, Lorimer Mosley, David Butler, lots of good people doing good work in terms of this stuff, to try to understand what's going on more. And and just recognize you're not alone. There's a lot of people that deal with this. Unfortunately, it's kind of an invisible thing. When you have a broken arm, everyone can see the cast, and gives you empathy and all that, and it's generally temporary, right? The arm heals and you take the cast off and you move on with life. With kind of persistent pain, you could look totally normal and be really hurting and potentially suffering on the inside. So it's hard to know that. And so seeking out support groups, whether in person and or online, is probably a good idea. And you could most likely Google that, ask your doctor, ask the local hospital, or even start your own, and bring people together. You can start a meetup group or whatever, to try to find out there's other people that are dealing with this, because most likely there are going to be. And you might do better in together, trying to figure things out and help each other understand things, and maybe find some meaning and purpose that goes beyond just suffering from that persistence pain. Okay, so I think that'll wrap it up here. Thank you very much for listening. Again, I'm Nick Markey, Beach Barbell, physical therapy, performance and strength training in Wilmington, North Carolina. Please, if you need anything, just reach out to me. If you need help with this kind of stuff, I'd certainly be willing to try to help you out the best I can. Thank you. Bye.